This is Dr. Mary from Modern Med. I'm joined today by Claire Hall. She's the research lead at Mindset Health, and I'm super excited to talk to her because the majority of our patients at Modern Med have chronic GI issues, the most common being IBS, and Mindset Health is all about that. So welcome, Claire. Thanks for coming.
Yeah, thank you so much for having me. It's great to be here.
I'm so excited. I met you guys at Digestive Disease Week years ago, and since then it's been a really important part of our practice and just incorporating gut-directed hypnotherapy, and all of the evidence behind it is so interesting and keeps on coming. And so I'm really excited to dive into that today with you and just talk about what hypnotherapy actually is. I think there's a big misconception about what it is and how it can have a really integral place in the treatment of disorders of the gut-brain interaction.
Yeah, absolutely. It's my favorite topic, talking about breaking down the stigma around hypnotherapy, because I certainly, before getting into this space, heard hypnotherapy, and you think of the doing the chicken dance or quacking like a duck, and clinical hypnotherapy is nothing like that. That's sort of the mainstream media stage hypnosis. Clinical hypnotherapy is really the experience to the patient sounds a lot more like a guided meditation. So if you've ever been through a guided meditation, that's really what it sounds like. The difference in clinical hypnotherapy, and specifically in gut-directed hypnotherapy, is that, throughout that guided visualization, there are suggestions for the improvement of GI function. So you'll hear very specific suggestions around improving IBS symptoms and GI function. And that has really shown through sort of packaging those suggestions in deep relaxation and focused attention that we can actually impact symptoms and symptom management for patients.
Yeah, that's a great explanation. It's as the person receiving gut-directed hypnotherapy, it does feel very much like a guided meditation. A lot of patients will come back and say, it's so relaxing, I fell asleep, it's the calmest I've felt all week when I do my session. And so I think that's a great reminder to us as to how it feels. But the suggestions piece sounds like it's the differentiating factor. My question to you is, what are the chances that people have done some sort of hypnotherapy, but it was actually a meditation, but it had suggestions in it? I've never thought of that before.
It's possible. I think the boundaries between clinical hypnotherapy and guided meditation are a little bit blurred. When you're doing clinical hypnotherapy for a specific target like IBS, the boundaries are a little bit less blurred, that it's pretty obvious that those suggestions are to the improvement of GI function. And it does sort of blur the lines in terms of the guided visualization. The actual hypnotic therapeutic part of those hypnotic suggestions are very much specific to hypnotherapy. So I think the experience itself will sound very familiar, and most people will have experienced something like it before, but the suggestions are that unique differentiator piece.
Yeah, and the specificity of it too, where it's clearly around the GI system. I want to rewind a little bit just to kind of lay the foundation here in terms of what irritable bowel syndrome is, why it's even considered a disorder of the gut-brain interaction, because that's really a change that's been made just in the last few years, where we went from functional bowel issues to disorders of the gut-brain interaction, because it plays an important piece as to why we would use a hypnotherapy to treat it. We want to talk a little bit about that, and I can fill in some of that stuff too.
Yeah, so IBS is diagnosed on the Rome 4 criteria. So really it's diagnosed by persistent abdominal pain, and that also has changes in stool habit and type. So the diagnosis of IBS is really around that abdominal pain and stool type and habit. Why it's classified as a disorder of gut-brain interaction, like you said, is sort of more recent, definitely interesting when it comes to implementing hypnotherapy. And disorders of gut-brain interaction like IBS are really caused by a miscommunication along that vagus nerve and along the gut-brain axis, which is not just the vagus nerve, but the main component of it is. And when you're having that miscommunication, then you're ending up with symptoms that manifests as IBS symptoms. And the interesting thing to note about it is, especially coming from the psychological therapy side of IBS management, most IBS patients have at some point in their diagnosis or pre-diagnosis have been told that it's stress induced, that it's really top down, that stress anxiety induced. And the interesting thing about it is that it really can be triggered from the top down, it can be triggered from the bottom up, but more often than not, it's the interplay between both. And we call it the IBS stress cycle. So it's not necessarily that stress and anxiety causes IBS, it's that you can be stressed, you can be anxious, and certainly cause a flare up. But then flare ups themselves also cause stress and anxiety, and you end up on this loop. And so we can target these symptoms with psychological therapies like gut-directed hypnotherapy. And really what we're targeting there is the miscommunication between the gut and the brain.
Yeah, and if you're listening, that stress IBS cycle is so important. And Dr. Williams and I broke it down on a previous podcast all on IBS. So I think it's well worth a listen to understand that. But that's what you're talking about when you're talking about bottom up or top down, meaning, yeah, stress can definitely, especially for some people, can be a trigger for IBS symptoms. And your IBS symptoms can definitely be a trigger for stress, anxiety, fear, frustration, and how those can start to create this like cyclone like effect that feed off of each other. And it's like, where do we intervene at this point? And so a lot of people come into us and say, well, I'm not stressed, but I'm stressed about my symptoms. And that's kind of where we're talking about this piece of the puzzle. And I think it can be frustrating sometimes when people are just told, yeah, we'll just do this meditation. And they say, well, it must all be in my head then. Like, why is this practitioner saying I need to meditate? I have a physical ailment that's going on. And so it gets to kind of the big question of, is this all in my head? What would you say when somebody says, is IBS in my head?
Absolutely not. It's absolutely manifests as very physical symptoms. And while psychological component can play a part in that, we know from looking at it through the biopsychosocial model, that is one piece of it. And it's certainly not the whole puzzle. I love talking about it. Most IBS sufferers, IBS patients have heard why the low FODMAP diet works. So I love framing it in this way, that if you're reducing those carbohydrates that are fermenting in the gut, you're reducing the pressure that's being put on those oversensitive nerves of the gut and that visceral hypersensitivity. And so you can understand conceptually why something like removing FODMAPs from the diet removes that pressure and therefore improves symptoms. And I think the problem with something like a psychological therapy is you don't necessarily have that clear diagram in your head of what is actually happening on a physical level to reduce symptoms. And the interesting thing about gut-directed hypnotherapy is that we know it really is acting on that same visceral hypersensitivity. So calming those same nerves lining the gut that are affected with reducing FODMAPs from the diet. And it's illustrated in an interesting study that was a balloon distension study that was done. The researchers inflated balloons in the rectum of very kind participants. And patients with IBS actually reported more pain with the same amount of balloon inflation than did patients who did not have IBS. And so you see that pressure on those nerves lining the gut is really more pronounced in IBS patients. And by introducing a psychological therapy like gut-directed hypnotherapy that can calm that visceral hypersensitivity, we can actually target that very physical pain with a psychological therapy. So it's not all in your head, most certainly not, and manifests very physically. However, we can manage it from that top-down approach.
Yeah, I love that study. I reference it all the time. There's a few studies that look at it differently, and they all say the same thing though, where people with this visceral hypersensitivity have just more sensitive nerve endings despite the actual volume of gas that's present in both the controls and the people with irritable bowel syndrome. And the analogy I like to use, I'm sure you guys have one that you use all the time, but it's like the sensor, whether it's a fire alarm sensor or whether it's the sensor in your car tires that tells that you have low pressure, those sensors can break. One broke in my car like last year and it kept saying I had low pressure and the pressure was fine when I actually checked it. And similarly, like a fire alarm, I'm guessing you can have different levels of sensitivity of when they sense smoke, whether it's just a candle burning or whether it's a full-fledged fire. There's some that are going to catch it at different levels. And with people with IBS, they have a very sensitive sensor, or potentially even a little bit of a broken sensor where it's sending pain signals when it shouldn't be sending pain signals, or when it wouldn't in a control subject. Do you like
Yeah.
that one? What do you guys use?
Yeah, I love that one. And I think the important thing to note about it, though, is that it really is an overreaction to what's happening and the amount of gas that's present. However, it's still an adaptive process. So we don't want to stop that communication altogether. We want to modulate it. We want it to be fine-tuned to the right sensitivity. But by saying it's something that is totally wrong with your body, it's really not. It's something that is very adaptive, and we want your gut to be communicating with your brain. We want your gut to be sensing when there's danger, but we don't want it to be sending those false alarms when the amount of danger is small compared to the reaction that it's driving.
Yeah, that makes sense. So it's more that the sensor isn't titrated correctly versus that it's broken altogether. And so to say we just want to start to help it to relearn what pain threshold, what a normal one may feel like, versus to get rid of the pain signal altogether.
Yeah. So part of the psychoeducation in the last week of the Nerva program is all about normalizing. And one thing we talk about a lot is for most people, for example, when you're traveling, there is some level of constipation that comes along with traveling. And I certainly fall
Same.
into that category.
Yeah.
And so for a lot of IBS patients that are in a decent level of control of IBS symptoms, that small thing like traveling and feeling that constipation can feel like it's a flare up or a relapse. And there is an element of recalibrating and re-understanding what normal GI symptoms are, and that most people experience a small normative range of GI symptoms at all times. And there really is no zero when it comes to having GI symptoms. Obviously, that's at the very end of a management protocol when symptoms are really under control, but there is that aspect of learning that renormalization of symptoms as well.
Yeah, and that's just part of our brain neurobiology, right? In terms of like when something is wrong, we pay more attention to it. And then that makes it really hard to discern normal versus abnormal, because everything feels abnormal because those senses are just expressed at a higher rate, right? So when we're talking about just being hyper vigilant to bodily sensations, that's a big part of irritable bowel syndrome. It happened to me the other day where I was like, I found this little thing on my thumb and I hadn't noticed it before, just like a little tiny like growth thing. And now it's all I can feel it. And it's not like it came overnight, like it's been there and I just haven't noticed it. But now all I feel when I feel my thumb is this little thing. And I'm like, oh, how did that get there?
I can totally relate to that. That happens to me all the time as well.
So yeah, so normalizing as a part of the treatment during IBS. And what does that look like? Like, how do we start to normalize when things are just bugging us? Like, we can use my thumb, for example, but it's like when something has all of your attention, how do you say, I don't want this to have my attention anymore?
Yeah, it's really hard to do. I think the way that gut directed hypnotherapy really acts on it is by, first of all, using the sessions to get you into a deeply relaxed state. So the reason those suggestions that I was speaking about at the beginning are offered while the patient is in a deeply relaxed state, because if you're already in a state of sympathetic arousal and you're already aroused and feeling the stress of your symptoms, the anxiety that goes along with the symptoms. And then we're asking you to feel like you're getting better and better over time and feel the ease and feel a reduction in abdominal pain. You're not going to be open to that. You're not going to feel like that's something that you can achieve. You're really going to put up your walls and resist that. And that's totally normal. And the way the hypnotherapy session works is getting you into that deep state of relaxation so that you can actually start to feel what symptom improvement might feel like and take that on board. And if we didn't do that package of the guided visualization alongside it, I don't think just telling someone the suggestions would have any effect at all. And to be honest, no one studied it because it would not be a well-designed study. But by packaging them in that state of deep relaxation, you can actually start to take on board what that might feel like. For example, in terms of abdominal pain and IBS symptoms, By actually getting you to start feeling what improvement might feel like and start thinking and visualizing what improvement might feel like, you're more open and willing to feel that change over time. It's not that we are drawing attention to it every day, and that's certainly not the goal of the sessions. We're not actually asking you to sit there and focus on the pain you're feeling, quite the opposite. We're having you feel relaxed and focus on improvement over time. So, not exactly what you're feeling in that moment. In fact, we actually really steer away from that. We're not asking you to do a symptom diary. We're not asking you to think about your symptoms every single day because we know that's not helpful in IBS patients, but we want you to feel relaxed and then visualize improvement. And we see that leads to IBS symptom management over time.
Yeah, and I want to pick up a really important piece that you said where scanning your body for what's wrong right now is like can definitely make things worse and not better, right? Because it's getting right back to that hypervigilance of what's everything feeling right now versus the likelihood that what you're experiencing is just normal physiological bodily sensations. And so to move away from that can be really helpful. From a neurology standpoint, physiology standpoint, how does gut-directed hypnotherapy actually start to work?
Yeah, so there was a good brain scan study that was done out of Dr. David Spiegel's lab at Stanford. They gave patients hypnotherapy while in a brain scan. They saw the increased communication between the brain regions that have to do with prefrontal cortex executive control, which would be the brain regions that are scanning your body at all times, looking for and acting hypervigilant on those symptoms. And then the brain regions that are implicated in that subconscious control when we're driving a car or we're doing things that don't take up a lot of active brain power. And there is an increased communication between these two brain regions. The thought is that by utilizing that subconscious and utilizing that deeply relaxed state that we use in hypnotherapy, that we can access some of these executive control network of managing symptoms over time and acting on that hypervigilance over time, but we can access it through that subconscious. What I was saying before, that deeply relaxed state, and then introducing those suggestions that you can really take those on board while you're in that subconscious state.
Yeah, that makes sense. And some of the research papers I've read in terms of the biopsychosocial model, they'll mention areas of the brain that are responsible for emotional control and emotional expression. And sometimes those are hyperactive in people with irritable bowel syndrome. Does that play into this at all in terms of how this works?
Yeah, it's honestly not well understood. And if we knew the exact mechanisms of how gut-directed hypnotherapy worked, it would be my favorite day ever. But we don't, unfortunately. And that is certainly part of it. We know with the biopsychosocial model that emotional control comes into how IBS can manifest in patients, but not always. And so there is possible implication there, but it's really not well understood. That is something that is with every patient in IBS.
Yeah, makes sense. And in terms of the results, so somebody has IBS, maybe they're on a medication, but they still have symptoms of abdominal pain and alternating diarrhea, constipation, and bloating, and they start gut-directed hypnotherapy. What are the stats in terms of likelihood to experience improvement? How much improvement in terms of expectations?
Yeah, so 71% of Nerva users see a clinically meaningful reduction in abdominal pain. Stressing that Nerva is also self-management, so it's not something that we really want you to be using Nerva alongside care from your provider. It's not something that is a treatment. It's not regulated by the FDA. However, in clinical trials, 71% of participants saw a reduction in GI symptoms, specifically abdominal pain. So it's something that we see really on par with in-person gut-directed hypnotherapy, certainly on par with other management strategies for IBS. So in another study that was done using the Nerva protocol, but in person, we saw that compared to a low FODMAP diet, both low FODMAP diet group and gut-directed hypnotherapy group saw there was no difference in outcomes at the end of program and then also followed out to 6 months. So they were as effective as one another. The great thing is we know it's been validated as a standalone management solution. However, when we look at the gold standard of managing IBS, we know the best thing for IBS patients is a multidisciplinary approach. And the biggest problem with gut-directed hypnotherapy is access to trained providers. There's only, I think, 400 GI psychologists in the world. So obviously access to gut-directed hypnotherapy is very limited. And we developed Nerva to increase access to high quality gut-directed hypnotherapy. And we've had over 200,000 patients go through the Nerva program. And like I said, we just released our clinical trials showing it's effective for 71% of patients.
Yeah, that's incredible. And we've definitely experienced that in our practice where there's a lot of people that get good results from this and really results that make it worth it for them. And a lot of people will also get results in other areas of their life that we've seen, just like feeling more calm and more relaxed in general. When you say clinically relevant reductions in symptoms, it doesn't have to be exact, but what are we looking at in terms of, is it reduction in IBS symptom severity score and how much, or how is that being measured?
Yeah, we look at both a 30% reduction on the IBS VAS, which is the visual analog scale, and the 30% reduction is the guideline that the FDA gives as clinically meaningful improvement. And then we also look at a 50-point reduction on the IBS SSS, which is the symptom severity scale. So across both, the 71% figure is specifically looking at the VAS, and then 81% on the IBS SSS. So slightly different across both, but they
Yeah.
both met variations of
Yeah.
the same.
Yeah, that's great. And we're not talking about like another medication to manage too. So this is like a lifestyle approach change. And completely agree, like the multidisciplinary approach to IBS has been by far the most successful thing. So when people come in open-minded and want to try diet, exercise, lifestyle, all of the things, we see the best results with our patients as well. There's one more thing that I wanted to talk about in terms of the research, and I sent you an email about it before in terms of the durability of effect. And so there was one study, I believe it was from Korea, that showed the durability was not maintained at 1 year. And I think you guys have shown something else at a 6-month mark. Can you talk a little bit about that and which one is more likely to be the case? And by the way, I still think even if something doesn't have durability, it doesn't mean that it's useless, right? Brushing your teeth does not have durability of effect. When you stop brushing your teeth, you no longer get the effects of brushing your teeth, but nobody's saying that makes brushing your teeth not worth it, right? We just brush our teeth every day.
That's a good way to put that. Yeah, so the study you sent, interestingly, that was published in 2002, I believe, or 2008. And that was looking a meta-analysis at looking at some of the early studies that had been done in gut-directed hypnotherapy. So the first clinical trial that was done was in 1984 in the UK. And in those first few studies, they were looking specifically at severe refractory cases of IBS, and they were pretty small studies. And it had really good success in those early studies. The long-term durability from the study that you sent, looking at those studies specifically, I think there's a bit of a question mark around long-term durability in those severe refractory cases. They did seem to improve really well in the short term. And then again, with that meta-analysis looking at long-term follow-ups, it was sort of unclear. In terms of the wider IBS population that we use gut-directed hypnotherapy with now, the long-term durability has been very good. In our clinical trial, we followed patients out to 6 months, and in a few clinical trials before that, they followed patients out to 6 months, and patients maintained in the long term to 6 months. There has been one other study that was done that was looking at patients out to 5 years, and I'm happy to send the link so you can link it in the show notes, that the study was done not in those severe refractory cases, and patients maintain improvement up to 5 years. I think the jury's a little bit out. I think in a wider, sort of more general IBS population, it seems to be a pretty good, robust effect. However, there's still some questions around those severe refractory cases. It can't hurt to try it. And if it's effective for you, certainly to continue listening. We always say there's no indication that you have to listen every day after the initial 6 weeks. However, it can't hurt to incorporate it. And if you've carved out a few minutes of your day for this self-care and self-care around your IBS, that it can't hurt to keep it as part of your lifestyle or keep something in that 20 minutes a day to manage stress, manage anxiety. And if it can be gut-directed hypnotherapy, that's great. We have a lot of patients that will incorporate it once or twice a week going forward and not listen every day. But having it there as a backup or a safety net is also not a bad thing at all. Jury's a little bit out on long-term durability for severe refractory cases, but in general population, it looks pretty good.
Okay. And there's a few different protocols for gut-directed hypnotherapy. It sounds like you guys are doing 20 minutes a day for 6 weeks. Is that
Yep.
correct? Okay. And then there's other protocols that are like once weekly sessions that are a little bit longer. I want to say an hour for 6 to 8 weeks. I could be wrong on the exactness of that, but has there been any studies that look at the difference between those two?
So there's actually never been studies looking at the different protocols head to head.
Interesting.
It would be really interesting to look at that. I will say in the study, in the protocols, so there's the Towson protocol out of the University of North Carolina, and then there's the Warwell protocol out of the UK. And in both of the other protocols, they don't have daily listening in person, but what they do is you go in to see the hypnotherapist once a week for 8, 12 weeks, whatever it is, but they give you audio recordings in between and they encourage you to listen every day just by recording that session. While on paper, the actual protocol of meeting with the hypnotherapist is slightly different, it is still repeated listening over time, very similar to how Nerva does it. Obviously, with Nerva, you don't have the in-person weekly visits, but it's pretty similar in structure. The Nerva protocol, the sessions are slightly shorter. I will say, even in the hour-long sessions from the Warwell protocol or the Palsson protocol, a lot of that is not the hypnotherapy session. There is psychoeducation in the session with the provider before you get into the actual hypnotherapy script part, which obviously we have psychoeducation within Nerva as well that's separate to those hypnotherapy recordings. So they're all pretty similar, to be honest. Of course, the structure is slightly different across them, but the meat of the hypnotherapy sessions is quite similar.
Yeah, really interesting. I think that would be good to look at. Anecdotally, because we've used both with our patients, the once weekly longer sessions, and we've definitely used Nerva with a lot of people as well. It also just makes sense to me that daily would maybe have a better effect because we are trying to like almost rewire pathways in the brain, and repetition makes sense to me for that. If you're trying to learn how to tie your shoes, you don't do it once a week, you try to learn every single day. For those listeners who are trying to learn how to tie their shoes, that's applicable.
I will tell you that I know from looking at our data that we've looked at predictors of response within our data set to see if number of listens per week is correlated with outcomes. So the recommendation is listening every day. Of course, people miss a day here and there. So we know if you listen 5 or more days per week, there's no difference in listening 5 days versus 7 days per week. So if you're missing a day here and there, no problem. Between 3 and 5 days, you see a slightly lower effect for patients. And then anything under 3 days, then we see quite a significant drop off in outcomes. So there's certainly, just from looking within the Nerva protocol, not comparing
Yeah.
it to protocols, we know from our protocol that there is a dose dependent effect, that the more you listen, the better off you are within those 3 ranges, of course. And like you said, habit building, rewiring over time really does seem to be effective.
Yeah, that makes a lot of sense. And that's really interesting and good for us to know too when people say, I'm not getting any results. Well, how often are you doing it should be a question, right? And that's with everything, right? Like when we exercise, well, how often are you exercising? The dose definitely matters on all of these things. Any testimonials that you have in terms, and I can tell you about what we've seen for Nerva in our practice, but what's the most common thing that people say after using it? Do you guys have people write in and say, this is the biggest change in X, Y, or Z that I've experienced, but anything that you can speak to there?
Yeah, our company Slack channel, we have a link to our Apple Store and Google Play Store reviews, and it comes through in one of our Slack channels in the company. And that's what keeps us going, because we see these reviews of people that have been dealing with IBS for 10 or 15 years, or even if it's a new diagnosis, but that IBS really impacts quality of life. So the testimonials we get are really raw and amazing testimonials, that it's not necessarily the I saw a 30% reduction in my
Yeah.
abdominal pain or my satisfaction with stool consistency. But it's more about the actual quality of life outcomes for patients. And we had one the other day that was someone who was able to go and spend the day with her grandkids for the first time in years. And so I think those are the ones that really hit home when you see the quality of life outcomes. And that means more than any point reduction on the VAS scale for sure.
Yeah, that makes it all worth it, right? Like real world outcomes, which, not even from a research perspective, but just actual lives that are being changed. That's very cool to be a part of. How did you get into this genre? How did you end up here?
Yeah, it's kind of a funny story. Mindset Health is based in Melbourne, Australia. And if you can tell, I'm based in the United States of America. And I reached out to Chris and Alex, who are the co-founders, because previous to this, I was working in a chronic pain research lab and was really disheartened by the state and the options for patients managing chronic pain, and did my own research into alternatives and found this whole area of hypnotherapy that is really well researched and really supported in the academic world, but there's very little understanding or access to it from the actual patient care side. So I found Chris and Alex and reached out because I found that they were doing this, and they were the only ones that I could find that were really doing this and trying to increase access to it. And they were kind enough to want to work with me as well. And so that's the short story of it. But I've been at Mindset Health for 4 years now, and we've grown. We have a whole suite of products now. So we have Nerva, we have Relio for chronic pain, chronic low back pain, Evia for menopausal hot flashes, Finito for smoking cessation, and Claria for mental health. So we have built this beautiful suite of products by taking and working with researchers who have built protocols and studied them from the academic research side, and then working with them to put that research into a mobile app so we can increase access to it for patients.
Yeah, so amazing. I got here because I had GI issues myself, and I think about it all the time. Like, I really wish I had something like Nerva at that point in my life, because, a lot of what was going on then is you see a gastroenterologist, you do the study, and then, okay, nothing's really wrong with you. Here's a laxative, deal with it. Just this whole other side of these disorders of the gut-brain interaction are now coming to the front of medicine. And like you said, there's still very little access in the actual medical community, or just knowing and understanding of it. I worked with a gastroenterologist for years, and this was not a part of the practice there. And so I think it's so important to get the word out, and we love what you guys are doing and are just really wanting to help you spread the knowledge to help more people. And we're really thankful the team at Nerva, Claire and her team, have given our listeners 25% off to Nerva, and we will put that link in the show notes. So check it out if you are interested. I've gone through it myself. I really love the program, and a lot of our patients have experienced a benefit from it as well. And it's one of those tools in the toolbox. So is it the entire thing? Likely not, but it's definitely a tool that can result in real improvements in some people. And so something to consider. Anything that we didn't talk about, Claire, that you wanted to discuss before we sign off?
No, I think we've touched on all the big stuff. And certainly, if you have any more questions or if anyone listening has more questions, I can pop my email in the show notes as well, and happy to answer questions about anything we do at Mindset Health.
Awesome. Thank you so much. Thanks for coming on, spreading your knowledge, and for everything that you guys do at Mindset Health. We really appreciate it.
Yeah, thank you.